Hi, my name's Liz Howard. I'm an osteopath at the Women's Health and Research Institute of Australia in Sydney, and we specialise in pelvic pain. So today we're speaking about pelvic girdle pain. So this is a pain that is often confused with low back pain, and we actually need to treat it and address it quite differently to low back pain, so it's important to learn the difference. Pelvic girdle pain is quite common in pregnancy, with 50% of women suffering. So today we'll talk a little bit about pregnancy-related pain, but we'll also speak about who gets it when they're not pregnant, because these seem to be missed quite often. So pelvic girdle pain often will come and go, and it will be there sometimes and then it will go. And most people manage it by just reducing their tasks. So where do we feel pelvic girdle pain? So it's usually at the front, and often people will say, I've got pain in the groin. So it could be one side or both sides. It can be across the front of the pubic bone here. And it also can be around at the back in the bottom. So it's usually one side or the other, and it can be both sides, and it can be all three. Sometimes it will swap and change, and that's quite normal with pelvic girdle pain. Women tend to get this pain more often than men, and we think this is probably because of joint laxity. So women's pelvises are designed to give birth, and so we have more flexible ligaments and connective tissues in this area. So women do suffer pelvic girdle pain more frequently than men, but men can also suffer this as well. So often this will be from a fall or an injury, and when the ligament is injured, then we don't have the same ability to weight bear. So there is treatment available, and we don't actually need to suffer through pregnancy when there's help available. So if you feel as though you're getting pain, particularly when you're walking, moving, standing, particularly when you're getting in and out of the car and rolling over in bed, especially at the front, then it could be pelvic girdle pain. So we're going to talk about a couple of tests you can do on yourself today, and then also some exercises and some things that might help. Pelvic girdle pain during pregnancy can be really quite restrictive, and 1 in 2 women will suffer from this, and 25 to 35% of these women, the pain will be quite severe. So this is not normal, and there is help that's available. So the best treatment is actually getting the diagnosis for a start, and then reassurance that actually this will get better. So that's the first step. The second step is manual therapy. So that means some help with freeing up those areas that are tight, and then we will give you some exercises that help rehab the area to make sure that it settles down, the pain settles down. So what exactly is pelvic girdle pain? It's a bit of a mouthful, but I've got the pelvis here to show you. So when we talk about the pelvic girdle, the main function of the pelvic girdle is for weight bearing. So when we have problems with this, that's when it becomes really difficult to walk for any long period of time, to stand on one leg, to do stairs, to move our body under load. So when we're carrying things, it'll be much, much worse. So the pelvic girdle is defined as this nice bony ring around the pelvis. So we have a female pelvis here, and this is the front, so that's the pubic joint at the front, and then this is the tailbone or the sacrum at the back. So the pelvic girdle is this nice bony ring, and it's held together nicely with ligaments at the front and back, and the muscles around our tummy muscles, our nice belt through there, the pelvic floor muscles at the bottom as well. And our nervous system needs to direct the right muscles to switch on at the right time so that we can nicely weight bear and walk in an efficient way. So we think with pelvic girdle pain is somehow this nice little team of joints, muscles, nervous system becomes a little disrupted. So there can be different reasons for that, but when this becomes disrupted, it means the whole system becomes inefficient. So then we have to use other muscles, other ligaments get irritated and inflamed, and then we can get the pain. So the pain often will occur at the symphysis pubis, or we call this the pubic joint. That's very common in pregnancy, but it can be common if we've had an injury, say a fall on the bottom, where we injure the ligaments at the front or the back. Or if we turn the pelvis around, very commonly we'll have women or men coming in and they're feeling pain like near the bottom. So the bottom muscles, they have to work a little bit harder, and so the bottom is really, really tight, and then we start to get pain from the muscles of the gluteal muscles, and then this tightness can even go all the way down the leg, and this can swap side to side. So sometimes people will have pain, for a couple of weeks on the left side, and then all of a sudden it might jump to the right, and then it might be in the groin for a little bit. The pain can even spread up, or it can go down the leg, all the way down the leg. So this ligament here is, the studies have shown that it can give you pain all the way down to the ankle. And if you're suffering from pain at the front, this can go all the way down the groin, inner thigh as well. So when you come in to see us, what we'll do is ask your pain story. So that will give us some clues as to why you've developed pelvic girdle pain. So when you're pregnant, it's easy. It's usually because of the ligament laxity. But when you're not pregnant, and say, for example, you had a fall a couple of years ago, then you may have had a surgery, and then you may have had a stressful event. This can often be quite a common story, and then the pelvic girdle pain will come and it will stay. So this is quite common, and we think this is because one of these areas in this little nice system here is not doing enough work. So for example, it may be if we have had a big surgery, and for the surgery it's necessary to cut through the abdominal wall, so particularly with big incisions, then this means that the nervous system, our brain, can't really switch on those muscles very efficiently, and that means other muscles have to do the work, and then over time that becomes too much work for them because they're not designed to work in isolation, and then we can develop the pain. So that's quite a common presentation, but it may be years down the track. Another thing that's worth mentioning is it's quite common in flexible people. So particularly dancers or people who are just genetically quite flexible, always been able to touch your toes, always been able to do the splits, that sort of thing. And this, we think, is once people lose their muscle tone, their nice muscle tone, then the ligaments have to work a bit harder, and then you can develop pelvic girdle pain. The other reason we see women quite commonly is when they have suffered from another pain for a long period of time. So this might be a young woman with endometriosis pain or period pain monthly over a long period of time. What our body will do is protect by pain, and our nervous system won't quite know how to switch on the right muscles that are effective for weight bearing. So we've got our nice little muscular belt through here, and it switches on nicely when everything's sort of in nice working order. So that is quite a common presentation where women have had other pelvic pains for a while, and then they'll develop pelvic girdle pain as well. Another common presentation is menopause. So sometimes we have women where they've had a big episode of pelvic girdle pain in their past. It might be related to pregnancy, it might be related to a surgery or a fall, or it might just be related to ligament laxity. And then when they hit menopause, it seems to be a trigger for bringing this pain back. And this is not uncommon with nerve pain and other pains because our nervous system is very interrelated with the immune system and the hormone system. So sometimes when one goes a bit funny, the others can also be triggered. So that's not uncommon too. So the good news is it's quite easy to treat. So it's quite easy to diagnose as well. So what you can do if you think you're suffering from pelvic girdle pain is a couple of simple tests. So I'll just pop the pelvis down. So the first one is to see how well can we actually stand on one leg. So obviously there are other issues that can cause balance issues. So if you've, say, just sprained your ankle, then this is not the ideal time, or if you have dizziness for other reasons. So it's just a guide, and just be cautious when you're doing this that you're not you're going to injure yourself. So be close to something something safe. So what you can do is just stand on one leg, and if you find you're a little bit wobbly, then that could indicate pelvic girdle pain. And we call that the load transfer test, because the main function of the pelvic girdle is to transfer load from our legs to our torso, and the torso to the legs when we're laying down. So that tests how well can we stand on one leg, and if we wobble, then we call that a positive test, and that's one indicator that may suggest you're suffering from pelvic girdle pain. If you find it's painful when you bend the leg up, then we call that a positive test for pubic symphysis pain. So that's also another indicator. That's a quick and easy test that you can do on yourself. So that's called the load transfer test. The other test we do in the clinic, and you can do it at home, either on the bed or on the floor. Just be careful getting down and up from the floor. What we'll get you to do is laying flat on your back, you would lift one leg up, about 20 centimeters, nice and slowly, letting it go down nice and slowly as well. So if this is difficult for you to do, then that can be another indicator that you may have pelvic girdle pain. And this one is really how easy or hard is the test. It's not really if it gives you pain, but does one leg feel heavier than the other? Is it quite easy to do, or is it really quite hard? So sometimes it can be quite surprising that it's quite difficult to lift the leg. And we would grade this from 0 to 5, where 0 is very easy to lift and 5 is you can't lift the leg at all. So that occurs in about 2 to 3% of people with pelvic girdle pain, where the dysfunction is so severe that it's really, really impossible to lift the leg, and it's really impossible to stand on one leg as well. So the other thing you can do to test yourself is actually put a little bit of pressure on the joints. So if we go back to our pelvis here, just put a little bit of pressure across the pubic joint, and is that tender? That will give you a good indicator. And same with the joints at the back. So the muscle bulk will be here. This is the bony tailbone. If you can put a firm bit of pressure through here on both sides, then that will really indicate, and particularly lower down, that can really indicate, oh yeah, that's where the pain is. And then there's another point up here where the muscle will be really quite tender. So that's fairly classic for pelvic girdle pain. And the main difference between low back pain and low back pain is usually higher. So it's here all the way down to the bottom fold, and we have to rule out, that you don't have back issues referring down into here. But usually pelvic girdle pain starts from the pelvis and goes down. It can go, anywhere really from the pelvis all the way down the leg, and especially at the front, all the way down to the knee. So low back pain needs to be checked as well, because you can get pain that starts in the back but goes down past the pelvis, so we need to check that as well. And it's a good idea to go and see a local osteopath or physiotherapist to just have these things checked. But if you go in with an idea that, oh, I think I might have pelvic girdle pain, then that's a really good start to getting the right help. So what do we use for managing pelvic girdle pain? So the stats are quite good in that 80% of people get better from this, which is really good to hear, because it can be very debilitating. There was a study in the Northern Europe countries that followed women for 15 years after pregnancy, and they found 10 to 11% of women still had quite significant pelvic girdle pain that affected their social life, their working life, and their ability to function normally up to 11 years later. So we'd like to get that number down, because pelvic girdle pain is actually really easy to treat, and most people do get better. So how do we get you better? So the main three things are the right diagnosis and reassurance that you will get better, and just an understanding of what's actually happening really helps us to drop the pain. So our brain will always be reassured in that, okay, now I know what's happening, I've got a plan. Straight away that will drop your pain, and there's a lot of good studies to show that if you can understand how the pain works, then that will actually help by itself. Second thing is manual therapy. So it's a good idea to ask your local osteopath or physiotherapist, have they had experience in pelvic girdle pain, because it's quite a specific area. It's quite different to treating low back pain, and if they're not familiar with it, then that just means it might take a little bit longer. The third thing we need to do is build up your stamina. So we do that with specific exercises, and these really do need to be individualized to you. So different people will present with different muscle tightness, different muscle weakness, and particularly we need to get the pain down a little bit, so then the nervous system is able to switch on the right muscles, the right belt for you, and then we just progress up from there. So what we can do to try and reduce the pain and get you back to exercising, because that's the main thing that we want to do. Exercising without pain is one of the main ways that the brain will send down descending modulation, and it will say, oh, it's not as bad as I thought down there. So it works quite well, and it changes the nervous system too. So what we like to do is cheat with the belt to try and keep try and get you moving again to exercise. And again, it's a good idea to consult your health professional so that you get the right belt for you. So we tend to use the Sorolla sacroiliac joint belt, and I'll just show you what it looks like. So it's industrial strength Velcro, this one. So what we do is, it's nice and thin and narrow, so people can wear it without people noticing too. So it's a standing and walking belt. It gives us that weight bearing capacity. So you might just use this if you say you're going on a walk, you're exercising, you're out and about, you might have it in your bag because you're out longer than you expected, because the standing around is really can really aggravate pelvic girdle pain. So it's a really good thing to just get you by, drop the pain while you're getting treatment, so that then you can progress with your exercises. So we know that this goes at the front, the label, and then we have these reinforcement straps, nice and flat. This part will go at the very back of the pelvis. So I can just show you how to put it on here. So we'd keep it very low on the pelvis, so we want to go over the sacroiliac joints there. And wrap it as tight as you can. We want to cover the pubic joint as well, so we're getting our nice little bony ring is getting support. And the right size for you will be, the emblem is approximately in the middle. So once we have this one tight, then we grasp the side, the reinforcement, and give it a really good stretch and stick it down. And then the other side, really good stretch, stick it down. And this provides nice support so that all our extra muscles that have been working hard, they don't have to work hard anymore while we're building up our muscle strength and reducing our pain. So it's a really good thing to use if it's suitable for you. And most women or men, when we find in the clinic, we have them in the clinic so you can try. So most people will feel it straight away. Oh yeah, this feels really good. So it's a good idea to try it before you buy it. And particularly an indicator is if you can't walk longer than 20 minutes without getting the pain, then it's probably worthwhile getting the belt. But do consult your local osteopath or physiotherapist for that. When we remove it, it's a good idea to loosen a little bit, walk around for a little bit so that your nervous system says, okay, I'm losing a little bit of support then, that's okay. And then I would loosen it a little bit again, and then just slowly take it off. So that's how you would use the belt. So another trick that we can use is using a small pillow to sleep at night. So often we find it gets quite achy at night, and particularly if you're laying on your side. So what we can do is use just a mini pillow like this, and if you place it between your knees, then that can make the night sleep much easier. So if you place it between your knees like that, A small one's usually easier, then you can take it with you when you roll, but usually the top sacroiliac joint will feel much, much better if you have a small pillow between your knees. So the other tip that is quite good and it gets you a really good sleep is if you have trouble rolling over in bed. So what you can do is buy something silky and shiny like this, and then that helps. It acts a little bit like a hospital slide sheet, so that actually helps you roll over at night, because when our abdominals are inefficient, that makes rolling quite hard. So that can be a good tip to rolling over in bed. The other thing that's quite important is to try and keep your knees together. So when you're rolling in bed, you would use your elbows, use your feet, push through the heels, and try and keep your knees together. Other things that can often aggravate is getting in and out of the car. Try and swivel all the way, have your knees together, and then use your legs and go nose over toes and up, so that you're not creating pain through the front there. So when you come for manual therapy, what sort of things would we do? So what we would look at is actually the whole body, and particularly those areas that typically get very tight when you've had pelvic girdle pain for a period of time. So we tend to find that your mid-back is very tight, the neck and shoulders can be very tight, the whole back is tight, but particularly into the bottom and the sides of the legs can be very tight. The inner thighs are very tight. So what we will do is use gentle techniques to relax those tight muscles off, and this then helps our nervous system to automatically switch on the muscles that have been in the background. The other thing we might do is look at the ligaments and see if we can gently ease the pain of those ligaments. And then what we would next do is exercise. So exercise is really the most important part of the rehabilitation for pelvic girdle pain, but getting the right amount of exercise for you without flaring the pain, that's the trick of it. So at WHRIA we see lots of women and some men who have multiple pain conditions in the pelvis, and so sometimes we need to go even a little bit slower, and that's quite normal because the nervous system needs some time to settle down, and we need to take our time so that we're not inducing tightness in other areas. For example, the pelvic floor muscles, they often can become quite tight and quite painful, and that can irritate other conditions like pudendal nerve pain. So we need to be just sensible about increasing your exercise quite slowly. So it's really good to have a guide to help you do that. So as we said, most people will get better with pelvic girdle pain with just standard treatment. So diagnosis, manual therapy, and exercise. In the sort of 2 to 3 to 4% that is quite severe, sometimes we may need a little extra help. So at WHRIA we have a diagnostic clinic that has specialised ultrasound. So sometimes we might use ultrasound to just check the quality of the ligaments. Is there any excess inflammation? Has there been any ligament damage from a fall or trauma? And then we can use that information to help us plan what we might do next. So some of the options when we find, say, persistent inflammation that just stays around and you're not responding to the usual treatment, we may use a local anaesthetic block. So we use local anaesthetic to inject into the joint and into the area where there's inflammation to just check, does this relieve your pain for the time that the anaesthetic is active? So say we inject through the sacroiliac joint and your usual pain is pain in the groin, pain down the leg at the back of the leg, and pain sort of through into the bottom. So when we inject that with local anaesthetic, we see for that day, sort of 2 to 4 to 6 hours, does that relieve all that pain? So then we know, yep, this is really the sacroiliac joint that's giving you this pain. And then we would leave it a little bit of time. Sometimes in some people that can be enough to have just a little pain holiday there, and they're doing their exercises, they're having treatment, they're doing all the right things, so then that can sometimes resolve. If we find it doesn't resolve, then we have some other options. So we can sometimes use cortisone if we find there's a high level of inflammation. So we can use cortisone and local anaesthetic in that area. And we'd always double check that with the ultrasound and making sure that it's going into the right area. So another option is platelet-rich plasma. So this is a fairly new treatment, but not that new, 10 to 15 years to 20 years. And this is called PRP, and it's often used in sports injuries to inject into tendons or ligaments. You may hear on the news some sports people get this. So what it does is we would take your blood, we would spin it so that the platelets are concentrated, then we activate them, and then we would inject those little platelets back into the joint or the ligament or the area that's inflamed or needs a bit of stimulation for regrowth. So what the platelets do is they have little growth factors in them, and then whichever tissue we inject them into, then your own body is stimulated to heal or self-resolve that area. So the inflammation tends to self-resolve, or if the ligament is a little bit thinned, then we can see on ultrasound that the ligament after 6 to 12 weeks has grown back and is much more supportive for the pelvic girdle. So in summary, pelvic girdle pain is quite common, and the good news is it's quite easy to get better. So if you think you're suffering from pelvic girdle pain, then see a local GP and they can recommend your local osteopath or physiotherapist. And if you're still having trouble, you can come and see us at the Women's Health and Research Institute of Australia in Sydney. So if you have any comments or general questions, you can write them in the comments section below and we will reply to that. Please keep them quite general because we're unable to give any specific medical advice. Okay, thank you.